Is the country's healthcare system ready for an Omicron-driven surge? That big question and more with Health Secretary Francisco Duque III. Secretary Duque, welcome to the big story.
Well, thank you very much in behalf of the Department of Health. Good evening, Robbie and Gretchen. And to your question, we have already tested our health system's capacity for the past 3 surges. And the last surge, August, September, we were able to manage our surge and eventually brought it down to the lowest levels that you've never seen before. So whether we will have a repeat of that and whether the health system's capacity will be there, yes, I would like to strongly say yes, the capacity is there. But we continue to review our capacity, our gaps, if any, especially because the Omicron variant is known to be much more transmissible than the Delta variant. And therefore, we need to make some adjustments in the light of the more transmissible Omicron variant.
Secretary Duque, nobody's calling it a surge just yet, pero yung numbers natin tumaas din over the past week. Do we know what's driving that?
Well, it could be many factors. Number one, it could be the holiday, the increased mobility, the social gatherings, the potential super spreader events. These are likely the reasons driving the slight uptick in the number of cases. But I hope it will be temporary. But at the same time, we have to be mindful that the threat of the Omicron variant is really real. It's very, very real.
Dr. Solante did say that it's important to determine if and when a surge does come, whether or not it's driven by Delta or Omicron. If it is driven by Omicron, what changes in the strategy and what needs to change in our capacity?
Well, in terms of the transmissibility, there are reports saying that the Omicron cases are mild relative to Delta. But if you consider that as an upside, relatively speaking, this can be easily negated by its transmissibility, which will translate into many, many more cases, which can threaten our health system and overwhelm the health system's capacity. So, maapektuhan lahat yan. So, we have to really watch this very closely, and for planning purposes, we have already asked our Epidemiology Bureau of the DOH to come up with definitive projected number of cases, given a set of assumptions.
Okay, maraming salamat po. Health Secretary Francisco Duque.